Now let's talk about the treatment of multiple myeloma. So the treatment of multiple myeloma is mainly decided on at what age the patient presents and whether the patient is fit or not. Generally, if the patient is less than 65 years of age and is fit, we say that this patient is eligible for what is called as autologous stem cell transplantation. That is, the patient's own stem cells are used to transplant the patient. The other scenario where the patients are over the age of 65 or are very weak and frail due to various other conditions like diabetes, hypertension, heart disease or lung disease, so on and so forth. Now let's talk about the first subset where the patient is fit and eligible for this autologous stem cell transplantation. So we give 4 months of a combination of chemotherapy and targeted therapy and look at the response by doing some blood tests and also doing a bone marrow to see how well the patient has responded. If the patient's response is adequate, subsequently we consolidate by doing this autologous stem cell transplantation. After the stem cell transplantation, we generally put the patient on maintenance with some oral targeted therapy or some injections which could be given subcutaneous. With this, the patient usually does well and has a decent survival and quality of life. If the patient relapses, we have second line chemotherapy and third line chemotherapy, and now we also have some novel treatment options like CAR T-cell therapy. Now let's take up the second subset where the patient is deemed not eligible for autologous stem cell transplantation due to various factors, if the patient is frail or because the patient is elderly. In this kind of situation, we give chemotherapy plus targeted therapy for a period of around 8 to 12 months and probably then switch over to some maintenance drugs which could be oral or subcutaneous.